Good evening. An investigation reveals the Trump administration's actions significantly hindered the Centers for Disease Control and Prevention's response to a major measles outbreak in Texas. As cases surged early this year, CDC scientists felt politically constrained, unable to freely communicate with local health officials. Emails show Texas health directors expressed feeling out here all alone as they grappled with the escalating crisis, with a child ultimately dying before CDC scientists made contact. The report details how, shortly after President Trump took office, the administration interfered with CDC communications, stalled reports, and censored data. This created an environment of fear and confusion, preventing experts from performing critical emergency response functions. One CDC researcher lamented, "All this training and then we weren't allowed to do anything." The outbreak, which became the worst in the U.S. in over 3 decades, highlights the dangers of declining vaccination rates and the spread of misinformation. While the CDC's efforts were stifled, Health Secretary Robert F. Kennedy, Jr., reportedly fueled doubt in vaccines and promoted vitamins as a defense. The consequences were severe. The outbreak spread to multiple states and Mexico, sickening thousands and claiming at least 16 lives. Local officials struggled to obtain timely guidance. Requests for consultations with CDC experts were met with delays and generic advice, prompting them to seek information from outside organizations. The CDC's communications office was reportedly the only avenue for information, with scientists themselves effectively silenced. Some scientists were allegedly diverted to remove information from websites to comply with executive orders, and staff layoffs added to the agency's instability. The article emphasizes that effective containment of contagious diseases relies on swift and open communication. The situation in Texas underscores the vulnerability of public health systems when subjected to political interference, particularly in communities with lower vaccination rates where mistrust and misinformation present additional challenges. Federal funding for the response did not arrive until late May, well after the crisis had peaked. The long-term repercussions of this outbreak, including its spread across borders, are still unfolding. If you like our content, don't forget to like and subscribe to our channel, News Today.